I'm going to talk about fluids. Over half of the body weight is water. So in an average adult, it is 65%. In an infant, it is 75%. And in elderly, it is 45%. The functions of water are transportation, heat regulation, maintenance of hydrogen balance, and it also helps with digestion. As you can see off of the transportation, I talk about different types of transportation. I have passive transport and active transport. Diffusion, osmosis, isotonic, hypertonic, hypotonic, and filtration are types of passive transport. The sodium pump is a good example of active transport. Passive is something that does automatically, and active, you have to do an action to make it transport. Where is the water in the body? In intracellular, it is 2/3 of the body fluid. In extracellular, it is 1/3 of the body fluid. Extracellular, there are 3 different places it could be: intravascular, interstitial, and transcellular. Off of the interstitial, I also talk about edema. Edema is the accumulation of fluid within the tissues. How often or how is fluid balance controlled? Osmoreceptors, that is also how people know if they're thirsty or not. The antidiuretic hormone, which pretty much tells the kidneys whether or not they can let go of fluids or if they need to hold it back. Aldosterone and atrial natriuretic peptide. Baroreceptors in the carotid sinus and aortic arch, and then the sympathetic and parasympathetic nervous system. So talking about fluids, there are ways to become dehydrated and overhydrated. Some of the signs and symptoms are thirst, poor skin turgor, weight loss, weakness, dizziness, decreased urine or dark and concentrated, elevated temperature, increased hematocrit, high urine specific gravity, thick saliva, rapid weak thready pulse. And this is caused by several different things. Some of them are impaired swallowing, extreme weakness, disorientation or coma, no water availability, so saying you don't have a source to get water, prolonged vomiting, diarrhea, more excessive diarrhea, hemorrhage, diaphoresis or sweating, excessive wound drainage, and diuretic therapy. And then overhydration symptoms would be weight gain, slow bounding pulse, elevated blood pressure, and possibly edema, crackles in the lungs when you listen closely, lethargy, visible necklines while laying down, decreased serum sodium, decreased hematocrit dilution, low urine specific gravity with high volume. And then at the bottom I also have the hematocrit levels. For women it would be 35 to 45 and men would be 44 to 54. And the urine specific gravity range is 1.010 to 1.030. Edema is I already explained what it is. It's the accumulation of freely moving interstitial fluid, and the causes are all different. Some of them are increase in capillary hydrostatic pressure, loss of plasma proteins, obstruction of lymphatic circulation, increase in capillary permeability, and there's different types of edema, and localized and generalized is not dependent at all, and it's usually just the inflammation of your feet and other areas, and it's not pitting. And then dependent would be feet, ankles, lower legs, or the sacral area, and usually is pitting. And you can tell if it's pitting or not by pressing in your fingers on a bony prominence. Hold it for 5 seconds, and if it lasts longer, you can tell if it's mild, moderate, deep, or very deep. So say it lasts for 4 to 5 minutes, it would be very deep, which is very severe pitting edema. On the top right, you can see dry lips, which would be another sign of dehydration. Elevating the legs will help edema go down in swelling if it's dependent. Normally, localized and generalized edema is not going to come and go. And then I also have pictures of an dehydration. So vomiting would be the middle little red man. You could also see that the guy is sweating a lot. And then there's kidneys. An example of sodium would be salt, and that is something that follows along with water in the body.
Now we're going to talk about acid-base imbalances. First we'll start with the ranges, which for oxygen is 80 to 100, CO2 35 to 45, pH is 7.35 to 7.45, the O2 sat would be 94% to 100%, and the bicarb is 22 to 26. Some of the imbalances are respiratory acidosis, which the cause for it is an increase in carbon dioxide levels, airway obstruction, pneumonia, asthma, COPD, emphysema, and opiate use due to decreased respirations. Some signs and symptoms are difficulty breathing, history of respiratory obstruction, dyspnea, weakness, dizziness, restlessness, sleepiness, and change in mental alertness. Metabolic acidosis is caused by loss of bicarbonate ions from diarrhea, renal failure, diabetic ketoacidosis, and hyperkalemia. Signs and symptoms would be weakness, lethargy, headache, confusion, vomiting, diarrhea, stupor, unconsciousness, coma, and death, and also fruity odor and ketone bodies, which was ketoacidosis. Respiratory alkalosis is caused by anxiety, high fever, aspirin overdose, and too much CO2 blown off. Signs and symptoms would be deep, rapid breathing, tingling in fingers, pallor around mouth, dizziness, spasms of the muscles and hands. And then metabolic alkalosis is caused by vomiting, extensive gastrointestinal suction, hypokalemia, excessive consumption of antacids with bicarbonate. Then some signs and symptoms would be irritability, discoloration, lethargy, muscle twitching, tingling and numbness of the fingers, and convulsions. Then also slow, shallow respirations, decreased chest movements, and cyanosis. One way to remember between metabolic and respiratory, and then also acidosis and alkalosis is using Rome. R being for respiratory, O being for opposite, which would be the oxygen and either CO2 or bicarb are going in two different directions. Then the M is metabolic, which would be equal, so the oxygen and O2 and bicarb would be going in the same direction.
Okay, so the last thing we're going to go ahead and talk about here is the IV therapy. We're going to start with the types of intravenous therapy. There's going to be three of them: isotonic, hypotonic, and hypertonic. Iso is equal, hypo is lower, and hyper is higher. There's going to be three different kinds of isotonic that I want to point out to you. It's the 5% dextrose, the 0.9% sodium chloride, and the lactated Ringer's irrigation. Those three right up there. Then we're going to go ahead and go down to ways to manage the IV infusions. You're going to help prevent infection by keeping the insertion site clean, minimize physical injury to the veins and surrounding tissues, administer the correct fluid at the prescribed time and at a safe rate of flow, and observe the patient's reaction to the fluid and medications being administered. So right there in the center, the person, medication, dose, time, route, documentation, reason, and response is something that we all know very, very well if you're looking into this kind of stuff. This is just another way to remember. The big eyes right there are observation. Looking at somebody after you got an IV in is a huge, huge thing. You can tell a lot of things just by looking at the insertion site. Last, we'll go over here to the measures to prevent complications of the IV therapy. So preventing any type of infection is washing your hands, whether it be with soap and water or sanitizer. Use strict aseptic technique. So this is not a sterile procedure. You're just required to wash your hands and use gloves when putting anything in or doing any changes. The normal changes to your dressings are going to be every 72 hours unless loose, soiled, or contaminated. Down here at the bottom I have an example of anything that may look soiled, damaged, anything like that. These are some pretty good examples here. You've got blood buildup right there in the center, and then on the bottom one it's soiled. It's not really soiled, it's just starting to come up, so there's getting to be a little bit of stuff on that sticky, even though it's not anywhere close to the site. But good rule of thumb is to check that every time you go into the room, and then every 72 hours, regardless if it was dirty or anything like that. And then, as always, you're going to watch the site closely because things like this could happen. On your right side, you've got redness and swelling and probably some heat starting. And then on the left is a really good picture of phlebitis. This is what happens when it gets infected and everything's still flowing through your veins. Starts to spread and pool up at the end.
Last thing I forgot to mention, the elderly generally have a 45% fluid rate in their body due to the fact that they drink a lot of coffee, are on diuretics. They also just don't drink as much as they used to due to the fact they're confused and need more help to get fluids in their system. Tic-tac-toe rule for the arterial blood gases. So here I have the normal pH, respiratory, and metabolic. These are the normal ranges. So what I'm going to do, I'm going to just make up a random pH. This is going to be my patient. So my patient is going to have a pH of, let's say, 7.22. Their respiratory is going to be about 50, and then their last one is going to be, let's do 30. All right, so first I'm going to start with pH. So this is going to be low, so it would be in the acidic. So I'll write pH over here. Respiratory is high, which is opposite, so then it would also be acidosis. So then I'd put that over here in the acid. Now, to see if your patient is compensating or not, we need to figure out, we need to finish our tic-tac-toe, and it's 30, so that's actually alkalosis. So here we see that I found that I have a respiratory acidosis, but my patient is partially compensating due to the fact that their metabolic is alkalosis.